Good afternoon, everyone. And thanks for joining us today. So the Lieutenant Governor and I want to use our regular 2 o'clock Tuesday press conference to provide Rhode Islanders with an update on the COVID-19 issues. So we are pleased to be here today with some familiar faces, with Dr. Nicole Alexander-Scott, Director of the Department of Health, and Tom McCarthy, Executive Director of the state's COVID-19 response. I'll make my comments, and then everyone will make their comments, and then we'll open it up to questions. So I want to say a thank you, special thank you to everybody who's covering this issue, in terms of not only for the last year, but also currently with the Delta variant being so much in the news, and certainly the people of Rhode Island want to make sure they hear what's going on. So thank you for the time to cover this in real time. So it's been a little bit of time between visits with both the doctor and Tom, but they've joined us here today. It's important for Rhode Island to know that our teams, our health teams, are in daily contact and are monitoring Rhode Island's numbers and looking at the data to make informed decisions to keep Rhode Islanders safe and healthy, and to keep our economy in the recovery mode. Right now, we know that our best tool to combat COVID and the Delta variant is vaccines. Let me say, and again, getting vaccinated is the #1 thing we can do to keep ourselves and those around us healthy and out of the hospital. And it's the #1 thing we can do to prevent COVID-related deaths. Yesterday, CNN reported that 99.1% of the people who are vaccinated are not going to be in the hospital, nor will they be, will we have to attend their funeral. So the vaccinations are the key, and that is why, if you haven't already, it is time to get vaccinated. It is time. And I'm going to, on the COVID numbers, let me just go through a couple of them, and then certainly the details, the doctor and Tom can kind of fill in the important details. So some of the updates of our vaccination progress and new vaccination policy for healthcare workers. Yesterday we reported 145 new cases. There was a lag in the data, and I'll share that. August 5th, there were 287. On the 6th, there were 227. On the 7th, there were 190. On the 8th, there were 117. Yesterday, there were 145 new cases. Our percent positivity yesterday, positive, was 3.2. We had 1 death and 6 additional people hospitalized as of yesterday. The 7-day hospitalization average, I don't think this is correct, so I'm not going to use that number. So, but I think the most important thing as being reported on the vaccination numbers, we are 5th and 6th in the country on first shots and second shots. Recently, we've had the lowest death rate in the country, and last week I think it was reported at 44. That means about 5 states were stronger than us. And our hospitalization rate was reported yesterday in the Providence Journal at 47. So there's only 3 states higher, that are stronger than us in the hospitalization rates per capita. So we're in a good spot, but that doesn't mean that we are not going to do everything we can to make sure that the people of the state of Rhode Island are safe. Safety is the top priority. And as I mentioned last week, our team is digging into the number of eligible Rhode Islanders who have not yet been vaccinated. For these individuals, my message is polite: it is time. It is time to get vaccinated. Every week, we're going to be counting that number down, looking at the demographics, and doing everything we can to reach those individuals who have not been vaccinated, to give them reasons to get vaccinated. Last Tuesday, we had more than 200, it was about 205,000 Rhode Islanders left to be vaccinated. Today, I'm glad to share that that has dipped below the 200,000 mark, and as of this afternoon, there are 194,588 eligible Rhode Islanders 12 and over who have not yet been vaccinated. Right now, just over 80% of Rhode Islanders age 18 and over have received at least one shot. We are officially over the 80% milestone, and as you know, I set the goal of getting to 90% as our goal, and we're starting to move towards that. 80.6% of Rhode Islanders 18 and older are fully are vaccinated, and 73% of eligible Rhode Islanders are fully vaccinated. For the past 4 weeks, we have seen a slight increase in the number of people getting vaccinated, and that's good news, and we want to see more of it. I saw this firsthand at a pop-up clinic we hosted at Buckland Park in Providence last week. I know that the Education Department did a robocall into the families to get them prepared for the opening of school. As a result, and I introduced myself to many middle school students in Providence that were along the line, and so we had 135 people get vaccinated. That's encouraging, because that's just in like one area of Providence, and when you multiply that effort around the state of Rhode Island, you're going to see why we're going to be moving, more and more people vaccinated in the state of Rhode Island. And that particular clinic, we had 16 people registered, but when the word got out, and we thank the Providence Public School District, along with the Department of Education, folks were calling their friends, and while they waited, again, that line kept on growing, and I was very happy to be introducing myself to everybody along the line and thank them for coming out and getting vaccinated, so that not only we keep the adults safe, but we also have a focus now clearly on the 12 and oldest. Rhode Island vaccinations efforts are going strong, and we continue to be in the top 5 in the country for vaccinations. We know that in order to stay ahead of the Delta variant and keep Rhode Islanders out of the hospital, we must keep that going. Today, we are announcing a new policy to make Rhode Island's healthcare facilities even safer and to make our vaccination numbers stronger. I want to thank the Rhode Island's healthcare workers for their heroic efforts through the pandemic, and we want to ensure you are safe and protected at work. That's why all healthcare workers in state-licensed healthcare facilities, as defined in statute, will be required to get vaccinated by October 1st, 2021, except individuals with medical exceptions. Until October 1st, all healthcare workers and providers who are not fully vaccinated will continue to be required to wear a surgical mask while inside a healthcare facility, and will be required to be tested at least 2 times a week. This goes for both public and private facilities. Shifting gears on the vaccination, on the Rhode Island Gives Vax Challenge update, I also have an update on our Rhode Island Gives Vax Challenge incentive program hosted in partnership with the Rhode Island Foundation. As of the end of last week, we reached our 25,000 first dose goal in just over a month, and surpassed that day as more than 27,000 have received their first dose since the challenge began. For reference, we have launched this program. Our estimates showed that we wouldn't reach the 25,000 first dose milestone until October. So the vaccinations are accelerating at a rapid rate, and I'll announce the round 4 recipients today, and we'll hold a special event to announce the last round and to recognize all these remarkable community organizations for supporting our COVID response. The round 4 nonprofit recipients of $10,000 grants are, and I list them with a great deal of respect and ask people to be supporting these organizations because they have supported us. Last week we were at the Elijah Project to present a $10,000 check from the state, and then Friends of the Elijah Project that were in the Pawtucket area actually came with another $10,000 check. So we know that these nonprofits are so extremely important to our state. And in addition to that, it allows the story to stay alive that vaccinations are important, and it is time. Operation Stand Down, Rhode Island. The Boys and Girls Club of East Providence. Rhode Island for Community and Justice. Lucy's Hearth. Amenity Aid. Hope's Harvest, Rhode Island. Capital City Community Centers. Progresso Latino. Clinica Esperanza. Forster Forward, Central Falls Family Self-Sufficiency Foundation, Close to Kids Rhode Island, New Beginning, Interfaith Counseling Center, Macaulay Ministries, We Share Hope, Johnny Cake Center of Peacedale, and the Providence Rescue Mission. We're fortunate to have all of them, so thank you so much for those who volunteer and work at those organizations to provide services to the people who live in all our 39 cities and towns. School district community vaccine strategy. There's one more key to our statewide vaccination efforts, and I'd like to outline it today. My office, the Department of Health, and the Department of Education have been working lockstep to ensure a safe return to the classroom for every child, which will be happening in the next few weeks. If you have not already been vaccinated, please get your child vaccinated. If they are eligible, please get them vaccinated. With school just around the corner, it is time. A statewide effort is underway to connect every single school district in Rhode Island with a school-based or community-based vaccination clinic. Many of these have already been started, and your school district should be reaching out to you directly with details about your district and your school. As a reminder, per CDC guidance, the state is strongly recommending that districts create a policy that requires all students, faculty, and staff to wear a mask indoors in school settings at the beginning of the school year. Some of our young people do not meet age requirements to get vaccinated, and we have to use all tools available to us to keep them safe and to prevent in-classroom learning disruption. We don't need to have students being quarantined because of an infection in the school. They need to be in the classroom, and we're working with not only the Providence School District, but school districts around the state of Rhode Island, so we all understand that our students need to be in the classroom. They can't afford to lose more time, as last year occurred, without any real way out of that, but at the same point in time, we don't need to repeat that. So we're going to use those remedies to make sure that our students are in the classrooms. Masks, as we've been saying, the vaccines are safe and they are very effective in preventing death and hospitalization. However, as we also been saying, the Delta variant is more contagious. And we are seeing that in the data, it is still possible to get COVID after you're vaccinated. Now, the vaccine will help prevent you from being hospitalized or dying, but there are still side effects. If you are one of the Rhode Islanders who does get COVID, even after you're vaccinated. Some of the side effects include you will feel sick and you may need to quarantine. If your child gets COVID, they will be out of school. Now, there are ways to help mitigate the risk of catching COVID, and we know they're effective. Now, before I say anything else, I want to say no one at this table is suggesting that the state impose a mask mandate again right now. What we are saying is you or your family need to know the risk of the Delta variant, and then, if you are vaccinated, make the decision that's best for you. If you want to wear a mask in public, wear a mask in public. Yesterday I was shopping with my daughter for hiking boots, and one of the stores I walked into asked me to put a mask on, and I did. So I carry a mask with me. The next store we actually bought the boots. There wasn't a requirement that was posted on the door, and we went in, and I didn't wear a mask while I was in that store. So it's going to be dependent on where you are, but I'm carrying a mask with me to accommodate those who feel as though it's necessary in their facilities. Be courteous and do as you're being asked to do. So what we are saying is you and your family need to know the risk of Delta variant. And then if you're vaccinated, make that decision that's best for you if you want to wear a mask in public. And this seems to be what Rhode Islanders are doing already. Like I said, I've seen it myself. Some folks were wearing a mask, some were not. They made the decision for themselves based on the comfort and weighing their risks. We will, of course, continue to monitor Rhode Island's numbers closely with the Department of Health, particularly in hospitalizations and deaths. So closing, I really can't say this enough. Our campaign is going to be, it is time. And it is time to get vaccinated. Those who are unvaccinated, we ask you, please, get vaccinated. So that's our mission, and please do not, please do your part. Visit vaccinateri.org or call 844-930-1779 to sign up over the phone.